Hello, welcome all to the video series Humanization and Rights in Pregnancy, Birth and Postpartum. In this video, we will talk about what a woman can do to succeed in breastfeeding. Breastfeeding is a practice that should be learned. People often think that it is just put the breast in the baby's mouth and the baby will immediately latch on and that's it. It's not just your responsibility as a woman and a mother. It is necessary that your family, people who help you in the day-to-day, and health professionals collaborate. When a baby is born, the breast produces a very pale milk called colostrum. All it takes is colostrum for this baby to be well fed. There is no need for water or other food. The biggest challenge at this point is how to get the baby on the breast. To help position the baby, cradle their head in the curve of your elbow and align their trunk so that their tummy is pressed against yours. To ensure a good latch, align the baby's mouth with your areola, colored part of the nipple. The baby's mouth should open like a goldfish, with the top of their mouth aligned with the top of the areola and the bottom of the mouth aligned with the bottom of the areola. On the second or third day after childbirth, the breast fills with milk. Your breast can produce too much milk and become firm with some redness. Pay attention to these signs. To avoid this, give the breast whenever the baby wants. And if you feel that the chest is hard, massage around the whole breast. The massage can also be done at bath time with warm water. You will feel more comfortable to offer the chest and avoid cracks. Not always the baby cries because he is hungry. Most babies like the smell of the mother, the warmth of the breast, the touch that the mother makes when breastfeeding, to look into mom's eyes. This story that baby on the arms or long breastfeeding gets spoiled is fake news. It's also important to remember that it doesn't matter if the birth was vaginal or cesarean. The faster the baby, who has just been born, is placed on skin to skin, the faster the breastfeeding will be. The first hour after birth is called the golden hour. What other benefits does breastfeeding bring to you and your baby? Hormones released during breastfeeding can promote contraction of smooth muscle, which helps with the contraction of your uterus to pre-pregnancy size. Breastfeeding can also help you get back to your pre-pregnancy weight. It may also reduce the risk of women getting breast cancer. Another good thing, breastfeeding helps you become more attached to the baby by affection. The breastfeeding mother confirms to herself her ability to continue generating life through the food that springs from her body. Decreased emotional tension is another good result of breastfeeding. When the baby breastfeeds, it helps mom's body produce a hormone called oxytocin. Oxytocin is called a love hormone and causes in mother and baby a sense of well-being and tranquility. Children who breastfeed tend to be quieter and easier to take part in social activities with other people and to socialize during childhood. Breastfeeding can also help some women get back to having sex because when the baby sucks on the breast, there is a response in the woman's body that can arouse sensations of pleasure. Other things help to awaken in the woman the desire to have sex after childbirth, such as people who can collaborate in the care of the baby, other children, and even in the work of cleaning the house, washing clothes, cooking, and everything else. Thus, there is little energy left over to feel pleasure in sexual intercourse. It is also important to say that working mothers who breastfeed may be entitled to reduce 1 hour of working hours per day to be able to go home early to breastfeed or arrive an hour late at work. Everyone gains from breastfeeding. everyone can participate together with the mother and baby in this important phase. Remember that if you do not breastfeed, you can give support and help.